Hi, it's Nathan. Section 368 through 378 of the Model WHS regulations covers health monitoring. Health monitoring is basically where we have to periodically send our workers off for health checkups to make sure that they're not being made sick by a hazardous chemical or substance that we're using. The most common ones we see are asbestos. It's probably the main one by far. And then in like metal fabrication and metal painting, sometimes you see isocyanates. I believe they're the only two I've ever actually seen require health monitoring. Benzene as well. But yeah, so Schedule 14 of the WHS regulations has a list of these chemicals, and then there's actually a separate section for asbestos, but yeah, there's health monitoring is this general requirement in these sections. And then in Schedule 14, it has a list of these chemicals, and then it has the type of health monitoring that's required. So for asbestos, that is a chest x-ray and spirometry. Spirometry is where like lung function test, where you blow into those tubes. Yeah, and with the idea being, we could potentially be exposed to this stuff in the workplace, so let's just and we should have controls in place to protect our workers, but we should be checking periodically to make sure we're not getting sick. And if we are getting sick, like better to find out sooner rather than later. And it's also got frequency, so like asbestos is 2 yearly, and I believe that's in a code. I don't actually believe there's specific frequencies in the regulations for asbestos. That recommendation is in the code. So then there's a bunch of requirements for when health monitoring is required and how it's done. So health monitoring isn't required just if you have these chemicals in the workplace, it's only if there's a risk of exposure. So just having like isocyanates in the workplace, if we've got really good controls in place and we're never being exposed, we don't need health monitoring. Health monitoring is only if there's a potential that our workers are being exposed. It says that the health monitoring needs to be conducted by a medical practitioner, obviously. It says we need to pay for it, or the business needs to pay for it. We need to obtain a copy of the report. We need to provide that report to the workers. If there's evidence of illness, we need to provide that report to the regulator, and we need to keep that report for 30 years. That's it.